today on the Nourishing You podcast.
And I'll tell you right now, if I'm looking at prevention, I would much rather send any person I know to either one of you two women than any cardiologist I've ever worked with.
Thank you for that.
That's a big compliment. Thank you very much.
What do you like? Tell me what you like.
There's value in that because it almost gives the brain like a vacation, right?
Holistic health is completely underappreciated, but so critical.
Eating whole foods, and
the key is just to find something that you really enjoy.
Welcome to the NANP Nourishing You podcast. I'm Kristen Burkett.
And I'm Diana Wally. We're your hosts for NANP's podcast dedicated to connecting holistic health enthusiasts with each other to share practical information from the holistic wellness space for enhanced vitality.
Diana and I are master nutrition therapists, board certified in holistic nutrition with private practices and an online joint venture that supports clients and practitioners as they strive to reach their full potential. We're honored to be hosting this podcast for NANP and connecting our listeners with the latest in holistic wellness.
If you enjoyed today's show, help us out by commenting below, liking this video, and subscribing to the channel to help us spread the word.
Hi, everyone. Welcome to this episode of the Nourishing You podcast. We're honored to talk with Dr. Jack Wolfson to explore a more integrative understanding of cardiovascular disease. Dr. Jack Wolfson is board-certified cardiologist who uses nutrition, lifestyle, and supplements to prevent and treat heart disease. He completed a 4-year medical degree, 3-year internal medicine residency, and a 3-year cardiology fellowship. He served as the chief fellow of his cardiology program, managing all of the other cardiology trainees. Dr. Wolfson then joined the largest cardiology group in the state of Arizona and spent 10 years as a hospital-based cardiologist, performing angiograms, pacemakers, and other cardiac procedures. He was the chairman of medicine, director of cardiology, and director of cardiac rehabilitation. He was selected by his peers as one of the Arizona top docs in 2011. In 2012, Dr. Wolfson founded Natural Heart Doctor to offer patients the ultimate in holistic heart care. People from all over the world consult with Dr. Wolfson, traveling to Arizona or virtually for natural heart care. Dr. Wolfson has appeared on every major news station and major newspaper, along with hundreds of appearances at live events, podcasts, and online interviews. He has taught medical doctors and practitioners from all over the world. Dr. Wolfson was recognized as one of the top 50 holistic medical practitioners. The Paleo Cardiologist, The Natural Way to Heart Health is the first book by Dr. Wolfson and is an Amazon bestseller. He is also a contributing author to the textbook of integrative cardiology. Welcome, Dr. Wolfson. Thank you so much for taking the time to talk with us today.
Thank you so much, Kristen and Diana. That intro sequence that you had before you introduced me was absolutely fantastic. And I'm actually in the middle of day 3 of a water fast. So I'm just salivating over all the images that you had on there. Anyways, it's great to be on. Happy to share all this information. Cardiovascular disease, #1 killer worldwide. Men, women, so many people are suffering. Pharmaceuticals are not the answer. There's definitely a better way.
Yeah, we're so grateful to have you, and we'll try to keep the nutrition food talk to a minimum since you're fasting. We wanted to have you on the show just for the reasons that you just stated. Cardiovascular disease, as you said, #1 killer. It's ubiquitous in the developed world. And it seems like conventional therapies for treating cardiovascular disease just aren't moving the needle, in terms of reducing the impact of this disease. I was reading that the first heart attack is fatal in close to 50% of people, which is an alarming statistic. So again, this is why we appreciate your holistic, natural approach to heart health that involves all of the things we love to talk about here, nutrition, lifestyle, etc. So before we dig into the crux of cardiovascular disease, though, we'd love to hear a recap of your story and how you came to the holistic field versus taking the more traditional cardiology path.
Well, I was a traditional cardiologist for 16 years with the biggest group in the state of Arizona, hospital-based cardiologist, angiograms, pacemakers, heart failure people, atrial fibrillation, strokes, kind of like, you name it. And along the way, back in 2005, I would meet the woman who would open up my eyes to what real health means. She was telling me that I was in the sickness model and I had to be in the health model. And I listened to what she had to say. She, saw so much sickness amongst my patients and also in my own personal family. My father at the time was dying of a rare neurologic disease similar to Parkinson's. And again, the Mayo Clinic has no idea why my father's sick and dying. And here is this 29-year-old chiropractor, and she's got all the reasons. So I listened to what she had to say. And then eventually I would leave that big cardiology group, open up my own practice in Arizona. And we're coming up on our 10th anniversary. We just opened up a brand new location. I've got a fantastic team around me. And like we said, again, heart disease is the number one killer worldwide, and just too many people are suffering. And as you mentioned, the pharmaceuticals are not, they're clearly not the answer. The surgical procedures are not the answer. There's a better way.
It's always so interesting to hear how people come to a more holistic, integrative approach. So that woman, so she's your wife now? Do we get that connection right? Yeah,
I guess that's the punchline of that. Yes, I quickly realized that she is the woman for me. And we got married and we've got 4 beautiful children, and we live holistically. As I tell people when I'm talking to them, I'm doing this interview right now in case anyone cares, which you don't, but I'm wearing organic cotton underwear. This is an organic t-shirt. I do have pajama bottoms on under this. Below, and they're organic as well. So we talk the talk and walk the walk. And unfortunately, a lot of people don't. We take it to the extreme, number one, because we want to be healthy. We want our children to be healthy, and we want to inspire other people to be healthy as well.
Wow, that's fantastic. Love it when, you can see right away that someone's living what they're preaching. So that's awesome. There's so many misconceptions about cardiovascular health. And a statistic I read last week from the CDC said that the deaths in 2020 from heart disease were still double the number of deaths from COVID. So, we're all on a tear to get rid of COVID, but we're not excited about heart disease. I don't understand the disconnect between, why wouldn't this have our country ramped up just as much, if not more, to see what's still happening with heart disease. So with so many misconceptions, it's hard to know where to start, but maybe you could get us going by describing how you see the real root causes of heart disease and what do you see underlying that?
Yeah, again, the answer is not statin drugs. The answer is not aspirin. Those have very little, if any, benefits. In the case of aspirin, people over the age of 70 years of age actually increases the risk of dying. People under the age of 70, there is very, very finite benefit to aspirin therapy. So even the American College of Cardiology at this point, for primary prevention, meaning you've never had a heart attack, stroke, angioplasty, stents, bypass, that's called primary prevention. There really is no role for aspirin. Again, don't stop or start anything based on what I'm talking about now. Check with your doctor. As it regards to statin drugs, again, statin drugs in a recent review in JAMA, the Journal of the American Medical Association, found that statin drugs on an annual basis for primary and secondary prevention combined, so you've already had an event, again, statin drugs benefit 0.2%, 0.2% heart attack reduction and 0.1% mortality, death from any cause is what it is. So what we're talking about, 0.1, 0.2%. Those are the facts according to them. And it's not about how do we reduce your chances of dying from 5% to 4.9%. It's about how do we get to 0%. And we know that model doesn't do that. They've published their numbers. And I think we have a lot better way, again, with what we do at Natural Heart Doctor. Eat well, live well, think well. Test, don't guess. Use evidence-based supplements to supplement where the deficiencies are. And that's pretty much what our motto is. And when we talk about eat well, live well, think well, no one is important than the other. We all tend to debate the whole nutrition story, but what about all the other lifestyle things that are critical? What about mental health and wellness? What about emotional health and wellness? And you brought up, COVID. And again, 2 years of COVID, more fear, more stress, more anxiety, more social isolation, more depression. Those are highly correlated to cardiovascular disease and dying from it. So yeah, we got our work cut out for us.
Yeah. So can you talk to us a little bit about how heart disease starts? I think there are many people that are surprised by a first heart attack or heart event and think that maybe it just happened yesterday. There was no progression leading up to that event. So can you talk about how heart disease starts, maybe how many years in advance of some sort of event?
Well, crazy enough, would you believe that heart disease starts when you're in the womb? Actually, heart disease could be said to starting before that. The health of your mother before she gets pregnant will impact her, not her genetics, but her epigenetics and how that goes into you inside of the womb. If you think about how we come from the sperm and the egg, well, the egg that was inside of your mother, that actually was forming when she was inside the womb of her mother. So the grandmother's health impact. So when we talk about the actual start of it, it really is back then. So now if we can change the generations going forward, this is how we can really impact health and wellness, down the road. We know from autopsy studies, specifically, it was first really noticed when young men, 18, 19, 20 years old, were coming back from the Korean War, and they were doing autopsies on them, and they found evidence of what is called fatty streaking of the vessels. And then ultimately, again, we're finding earlier and earlier very aggressive coronary artery disease. It is not uncommon to see people with heart attacks in 30s, 40s, and 50s. And I do want to mention a couple things right now that I want to make sure that I get out, to all the people who are listening, because my guess is there's a heavy slant towards women in this channel. I'm just guessing. I'm not trying to be sexist, but I'm just guessing. And oftentimes, again, the people that I see, the husband is dragged into the office by the woman. So again, the woman tends to be much more in tune in general. But I want to mention two things. One is a diagnosis called SCAD, spontaneous coronary artery dissection. That is the number one cause of heart attacks in women under 50. And it typically is stress induced. It's called, again, SCAD, SCAD. And the other is what's called broken heart syndrome, or the official diagnosis is Takotsubo cardiomyopathy. And what that is that is a heart failure that comes after a stressful event, and it typically happens in women ages 40 to 60. Now, again, it's a big stressor, a divorce, a death, something happened at work. And I've seen all these in my patients as well. So I wanted to get that out there, to everyone. But, again, heart disease, it's so multifaceted of what the causes are, but I want people to understand really that stress and that mental health and what we call think well is absolutely critical, and just as important as eat well, live well.
So we come into this world with a certain level of risk based on our ancestors, I guess, right? So our past generations. Not a whole lot we can do about that part, but of course we can make a difference for those we bring into the world and who they might bring into the world. So it makes sense to still to care about that, obviously. But we come into this world with a certain level of risk. Are there other factors that put us at risk? Like, how much is genetics a part of our cardiovascular disease risk versus the genetics just being there to have something triggered, or other lifestyle factors? So how does all of that wind in? Who's at more risk than others?
Yeah, back when I was in training in the late 90s, it was a big deal about the Human Genome Project, and we're going to learn all the genes and we're going to study all that. And what we found from the Human Genome Project is that it's not the genes. Your genes are essentially perfect. Think about how again, what we can do. We can run and jump, and we can feel, and we can see and hear. We have all these amazing abilities. We can make babies. Our genetics are just about perfect. It is our eat well, live well, think well that screws up with our genetics, if you will, and then leads to disease. And that, unfortunately, it starts very early on. But when people blame it on genetics, it's a cop-out. When the doctors blame it on genetics, they are wrong. All disease, aside from a rare, genetic mutation, so like the rare situation, well over 90% of all disease is man-made, if not, again, close to that 100% number. It is man-made, it is human-made, and therefore, which is great because a lot of that can be reversible when we reverse the cause of what's causing all this illness.
I like how that really empowers people to think about that. So how much of that is within your control? So I like that message.
Well, if I can, I want to say one more thing too. It's kind of like, I give this example to people. There was a movie 20 plus years ago called Castaway, and the movie Castaway with the actor Tom Hanks, right? He winds up on the island with the volleyball Wilson. So on the island, he goes to sleep with the sun down. He awakes before the sunrise. He watches the sunrise. He spends the day in and out of the sun wearing a loincloth. He eats fish, coconuts, avocados, vegetables, and fruits. He lives in an area that is, for the most part, pollution free, as much as any place could be pollution free on this planet. Mm-hmm. He is very physically active. He's not in the gym on the treadmill, running for 45 minutes while watching the news. And again, so he's out there in the environment. And my point to people is that aside from the fact that he's lonely and he's socially isolated, which is a big, big, big problem, 2 years, the past 2 years have really highlighted that more so than ever. But again, if everybody was essentially born onto that island and lived that island lifestyle with any genetics, they'll live till they're 125. It doesn't matter what your genetics are if you live on that island. So we teach people to find that island as much as we can. Some people move to the island. Some people, again, try and bring that island mentality as much to their lives as they can. It's very difficult to get healthy in the same environment where you got sick. So we got to change it up.
Yeah. I was always glad he had Wilson, and then it was so sad when he lost him. I remember that part of the movie. So I think that's a really good clarification point about having the right environment to allow your genes to do the job they're supposed to do, right? So the other, argument we hear all the time that I think has so many misconceptions that have evolved around it is the whole idea about cholesterol and how cholesterol is the biggest issue with heart disease. Can you clarify that? Can you kind of pull that apart for us and address that?
Yeah, the whole cholesterol hypothesis is, again, it's a hypothesis, and it really started in the 1950s and 60s based on some spurious information by some researchers, and essentially they were all in bed with the food industry. So let's get away from eating farm-to-table stuff. Let's get away from eating hunter-gatherer foods, and let's just eat things out of a box and things that are artificial, and again, high carb, which sits on the shelves for a long period of time. Let's get the fat out of milk. Let's stop eating, so much meat and whatnot. And again, the pharmaceutical companies jumped on board with that as well, trying to sell us pharmaceuticals to drive down cholesterol numbers. The pharmaceutical Lipitor is the number one selling drug of all time in revenue. Lipitor, a statin drug, and it's really just it's a myth. Again, cholesterol makes up our digestion. Again, the liver makes cholesterol, puts it into the gallbladder to help us digest our food. Vitamin D comes from cholesterol. So when the sun hits cholesterol coursing through the skin, through the blood vessels of the skin, sun hits it, turns it into vitamin D. If we think about all of our hormones, they come from cholesterol. Again, so all of our sex hormones, cortisol, aldosterone, these are coming from the cholesterol molecule. And then ultimately, if we think about the brains of the cell, I want everyone to understand, is not the DNA. The DNA is the genetic material that codes for proteins, but the real brain of the cell is the cell membrane. And that cell membrane decides what gets inside the cell and what should stay outside of the cell. And let me tell you this, a major component of the cell membrane is cholesterol. The other major component, in short, is omega-3 fats that come from seafood, which means seafood is the healthiest food on the planet, and there really is no second place.
So from what you're saying, cholesterol is super important for a lot of functions in the body. The body makes cholesterol. We would die without it. So all of that being said, what are some of the downsides of overdoing statins?
Well, again, the downside of the statins, I think number one is like a false sense of security. Take Lipitor and go eat and live however you want. That's number one. Number two, a lot of side effects from statin drugs. This is well published in the medical literature. And again, because we're not addressing the cause, we're not looking at eat well, live well, think well. People don't do that. So the reality is that they get a little tiny fraction of benefit according to their data, from the statin pharmaceuticals. And again, I want everyone to know statin drugs markedly lower your cholesterol down, your LDLs down, but we don't get any awards for that. No one gets a bonus because they have very low cholesterol. We want to know, if I take a pharmaceutical, any pharmaceutical, will it help me live better? Will it help me live longer? And in the case of statin drugs, again, they really, really don't. So, cholesterol, as you said, every animal on planet Earth has cholesterol. Mother's breast milk is loaded with cholesterol. It's a very, very important critical molecule for all these different functions. And unfortunately, it's just been vilified. But if we're looking at kind of cholesterol as a marker of risk, between 160 and 260 is that sweet spot of total cholesterol. Above 260, increased risk of dying. Below 160, increased risk of dying. We know that from the 1970s, from the Mr. Fit trial. Even LDLs and HDLs, we need more information. When it comes to lipids, the most important thing is the ApoB, ApoA1 ratio. So every major laboratory checks ApoB, ApoA1. The lower the ratio, the better on that. We've known that since the early 2000s. And even a more important marker looking at risk of really all diseases, certainly than cholesterol, is inflammation. Measure the markers of inflammation. If you're inflamed, you better figure out why.
So how would someone get that from their physician, the marker of inflammation?
Well, again, I've got like a top 20, lab tests in my book, and, you can find different places like that. We have more information on our website as it pertains to the tests you want to ask your medical doctor for. But I mean, just kind of a quick review. Again, we want that ApoB, ApoA ratio. You want to know about something called Lp(a). That is actually a genetic marker that does increase risk. I think, again, we have to turn on those genes in a negative fashion, but Lp(a), again, all those markers of inflammation, oxidative stress, HSCRP, myeloperoxidase, oxidized LDL, phospholipase A2, a lot of those. And then, of course, looking at fasting insulin, fasting glucose, hemoglobin A1C. We can also do intracellular testing, looking at intracellular glutathione levels. There was an article that I read during COVID where it said that glutathione deficiency, low levels of glutathione, which is the body's main antioxidant, does so many magical things. Chelator, low levels of glutathione is actually the biggest risk factor for COVID hospitalization and mortality. Very interesting. So what are your intracellular levels of glutathione? People with the highest levels of glutathione, 75% lower risk of dying from heart disease. And you don't even know your number. No one even gets tested for this. If you ask your doctor, most of them will look at you with a blank stare. Again, intracellular, other vitamins, B vitamin status, homocysteine, vitamin D, omega-3 levels. Our policy is, again, test, don't guess. And then, we were kind of talking about this, as well, is that we also do urine testing for toxic metals, over 30 different toxic mold mycotoxins, and 40 different environmental toxins. So we can show to people, hey, you're being poisoned, and this is what's causing your inflammation. And then finally, let me say this, one other test that we do looks at leaky gut or intestinal hyperpermeability, and over 30 different antibodies to gluten and the non-gluten components of wheat. So again, if you're under the care of a functional medicine doctor who's able to get all these tests done, I think that's a great place. And even just functional nutritionists, and there's plenty of functional nutritionists who are doing the same thing. And I'll tell you right now, if I'm looking at prevention, I would much rather send any person I know to either one of you two women than any cardiologist I've ever worked with.
Thank you for that.
That's a big compliment. Thank you very much. Hopefully we're doing you justice in what we're doing with our clients. And we do try to. So you said a whole lot in that last couple minutes there. And so I just want to make sure that we clarify and kind of hone in on a couple of points, because I think for most people, the belief is that looking at their LDL level is their marker for determining whether or not they're at risk for heart disease. And what we're saying here is, no, this is not the end all be all. And maybe LDL is more of a reflection of other inflammatory processes in your body versus being the problem. So when we take a statin and we lower that LDL, we're actually lowering our body's ability to calm that inflammation down, because doesn't LDL sort of quench inflammation? Isn't that the role of it? Is that?
Yeah, no, that's a fantastic point. And unfortunately, what you just said indicates your knowledge is greater than, honestly, most cardiologists. I mean, again, the cardiologists are great. If you're having a heart attack, you need, emergency surgery, they're all fantastic. But we're talking about prevention here. And again, LDL was vilified as the bad cholesterol. Can you imagine that every mammalian species on planet Earth has LDL particles? And the drug companies make us believe and make the doctors believe that LDL is the bad cholesterol. If it's so bad, why does every animal species make it? Just as you said, LDL has a purpose. HDL has a purpose. LDL is the bus that leaves the liver. The passengers on the bus are cholesterol to be taken around the body, triglycerides for fuel, fat-soluble vitamins, A, D, E, K, CoQ10 is on that LDL bus. And as you pointed out, LDL actually has an antioxidant function. So it helps with inflammation, helps with oxidative stress. And you're right. If it's elevated, we need to figure out why. We don't just take a pharmaceutical to shut down the production of it. Again, that's just insanity. That's kind of like, the equivalent of, you're driving down the road and the check oil light goes on and you're like, yeah, I'm not going to listen to that. I'm just going to put a, little sticker above the check oil light. And eventually, the car dies. And so will you if you follow the traditional medical doctor's advice, sadly.
Okay. And then the other point I just wanted to make sure we clarified for everyone listening is when you talked about measuring the ApoA and ApoB and the Lp(a), that's where you're saying maybe there are some markers of types of LDL that can be more telling about your risk versus the overall LDL. So am I saying that right? I just want to make sure.
Yeah, no, you definitely are. So again, like those small, dense LDL particles in high levels, those are known to be correlated with high risk. The oxidized LDLs, the damaged LDL particles, the more of those are around, the higher our risk. And really what's happening is that the liver is making these LDL particles, and that's all fine and dandy, but we're not clearing out those particles because our liver tends to be very toxic. So our liver is toxic, and the LDL receptors that are pulling the LDLs out of the circulation, they're not being produced, or they're dysfunctional because it's a receptor issue. Maybe there's an autoimmune attack on the receptors. Maybe there's something blocking the receptors, like a metal, like a mold mycotoxin, like an environmental toxin. And again, we need to really assess, the why. And then once we kind of clean out that liver, once we start to detoxify, that's how we start to move these old lipid particles out of our body and find what I would call our caveman cholesterol, cave person cholesterol, the perfect cholesterol for each one of us, the perfect cholesterol, perfect LDL, perfect HDL. And that's what our ancestors enjoyed. And that's what we got to get back to.
Caveman cholesterol is my new favorite. I have not heard that. Love that.
Cave person. I'm sorry.
Cave person.
Cave person.
I got
cave
it.
person.
I got it. Yeah. So all of that being said, talk to us about what we can each do individually to reduce our risk of heart disease, to have a healthy heart, talking about nutrition, lifestyle, fitness. So give us the lowdown there.
Well, when it comes to eat well, again, I am the paleocardiologist. I do believe in hunter-gatherer. I know there's a million different diets out there. And let me say this, no matter what diet you're on, vegan, vegetarian, paleo, keto, carnivore, make it organic. Get the chemicals out of our food, get the pesticides out, the artificials out, get all of that poison out of our life. Let's all agree on that. So if you like chocolate, eat organic chocolate. You like ice cream, eat organic ice cream, or preferably make your own. If you drink alcohol, make it organic alcohol. If you're a coffee drinker, make it organic coffee. Again, all plant materials need to be organic. And we talk about animal products. We're talking about free range, grass-fed, grass-finished meats. That's all that we eat. And then from seafood standpoint, wild seafood, sardines, anchovies, wild salmon, of course. Salmon roe is a magical miracle food. And then shellfish, clams, oysters, shrimp, crab, lobster. That's all great. Bone broths, seafood broths. All that stuff is absolutely critical. The other thing I'm always 100% gluten-free. I never eat gluten. I don't see any reason to eat wheat, barley, or rye. And that's something that I see in my patients as well, that they tend to do very well off of gluten. But again, as it pertains to the eat well, just make your food organic, get the chemicals out, and then we can continue the debate regarding the food. I do want to say, when it comes to animal products, of course, nose to tail, liver, heart, kidney, all those foods were recognized and are still recognized by native cultures, animals in the wild. The liver is the most nutrient-dense food in the world. There's, again, it's absolutely spectacular. And what we do know as well with the seafood, people with the highest levels of omega-3s from the food have the lowest risk of everything. Lowest risk of everything. So let's make sure that, again, that I think, again, there's so much debate in the industry. I'm not going to change necessarily anyone's mind in this conversation. I know what works for me, for nature. I just want to bash, vegans and veganism. So I just want to, again, just trash that as a diet concept. It is an experiment on people. And I think it's a very bad experiment. So I'm happy to kind of go on as far as my other facets. Nutrition tends to be the most fun to talk about for a lot of people. But again, I don't want to give slight to the importance of sunshine and that our skin here, what is the purpose of our skin? Is it just to put lotions on and moisturizers on? Is it for sweating? Does it just hold together a bag of bones? The skin is a solar panel built to absorb the solar radiation from the sun. The eyes, of course, same thing. They are solar panels, our windows to the world. The more we get our solar panel with smart sunshine out into the world, the better off we are. And to wrap up this long thread here, our ancestors went to sleep shortly after the sundown. They woke up before the sunrise. They watched the sunrise, and they also watched the sunset. And there is magic in that. And then again, they went to bed after the sunset. Any amount of time you are awake after the sundown, and you're in the artificial light, you're causing brain damage, heart disease, and more.
Wow. So those are some really good basic pillars. It's like going back to, where we started as humans, right? And following the things that were instinctual for us a long time ago, I think is what you're saying. Maybe we could drill down on a couple of those points that you made, because I think it would be good for our audience here. So I want to go back to a couple of the nutrition pieces, but before that, I want to go back to the sunshine. And when you talk about getting healthy levels of sunshine, I think we have a lot of, again, misconceptions about how can we do sunshine in a healthy way, because people are so afraid of skin cancer. So can you talk to us about what does such healthy levels of sunshine look like? What does that mean for us?
Well, again, going back to that Tom Hanks analogy, he was outside in the sun. Our ancestors, were out in the sun. All animals are in the sun. All plants are in the sun. The vilification of that, again, I can't, I can come up with some possible reasons as to, again, how the sun got the bad rap. But again, the people with the highest levels of vitamin D, lowest risk of everything. Where do you get vitamin D from? It's not from a pill bottle. It's from the sunshine. And it's also from eating animal and seafood. You can't get it from plants, save maybe a tiny fraction from mushrooms. So, again, being outside in the sun increases nitric oxide levels. Nitric oxide is a gas floating around in our bodies that opens up blood vessels, leads to relaxation. When you're out in the sun, helps you make a lot of melatonin. So when you go to sleep at night, now your melatonin spikes, and amazing things happen from high levels of melatonin. And if we think about skin cancer, actually, the people with the lowest risk of melanoma skin cancer, which is the deadly cancer, those are outdoor workers. The people who work outside have the lowest risk of melanoma, but we want to do it all together the right way. Eat well, live well, think well. And when you put all those together, that's actually nature's protection. So when you go to sleep on time, when you get the sunshine, when you're eating those seafoods where the omega-3s are protective, vitamin A from animal products, is extremely protective to the skin, to the eyes. So when we're doing all this stuff together, that's really what the key is going to be. People with squamous cell and basal cell, again, why would the sun, something we've been in since the dawn of human existence, why would that cause cancer? It's not. It's man-made. Now, that being said, when I grew up in Chicago and I went on a trip with my family or went with some buddies, for spring break, and we slept until, 11 a.m. and then we would go eat and then go out into the sun at noon and get absolutely burnt. That was bad. But the smart sunshine, a little bit in the morning, a little bit in the noon, a little bit in the afternoon, and slowly build up. But, just please understand that, again, the people who live inside, they're at tremendous risk. And again, if you're worried about skin cancer, again, the people with the highest levels of vitamin D have the lowest risk of cardiovascular disease, the number one killer worldwide. I would tell you, don't worry about skin cancer, even if you are. I would worry about heart disease. That's the number one killer, not skin cancer. So appreciate the fact that, again, smart sun is key. If you use sunscreen, make sure it's an organic sunscreen.
Kristen, I know you have a nutrition question, and I just have one to sneak in.
Oh, yeah.
So, Kristen, you probably hear the same thing. Dr. Wolfson, I can't tell you the number of clients that come to me and have, high cholesterol. Okay, well, I guess I have to give up eggs. So can you talk to us about why eggs in particular seem to be so vilified when it comes to heart health?
I think once again, it just goes back to the 1960s where kind of eggs containing cholesterol where it just became this classic example of the food to avoid. And why would we want people to eat eggs when they could eat Cheerios and Frosted Flakes and oatmeal? For obviously all the different business reasons that somebody would do so. An egg is a cocoon for a baby chicken. It contains everything that a chicken needs to come to life. That's why the cholesterol's in there, because that's what the chicken eats the yolk as it's actually coming to life. Try raising a chicken on oatmeal. You're not going to get very far. Pasture raised, free range, organic eggs are absolutely magical. Do not cut those out of your diet. There's plenty of other stuff you can cut out of your diet. All animals in the wild, right? They'll go after another animal's eggs all day long. They're smart. Try and feed an animal oatmeal and they're not interested.
And so the reason behind that, I think what you're saying has to do with the fact that when people have high cholesterol, it's not typically food driven. It's liver production. And the amount of cholesterol that we actually have circulating in our system from food is pretty minimal. Is that correct?
Yeah, I think, listen, you brought that up earlier because, we have to ask why. If the body is making a lot of LDL particles, why? If the liver is not clearing out the LDL particles, why? And that's what we need to really focus on. And unfortunately, again, the medical doctors, it's just, the only thing they have is the hammer, statin drugs, and therefore every patient looks like a nail. And it's unfortunate for the medical doctors because they're not trained with this information. We receive zero training in nutrition and actual causation. We get all the training from pharmaceuticals and surgeries because, again, since the early 1900s, that is how the medical education is funded by pharmaceutical industry. It's funded by big agriculture. And, whether I was a internal medicine resident, cardiology fellow, always getting freebies and stuff like that from the pharmaceutical representatives, and then even again into practice, and it still happens all day long. Again, the doctors are getting educated or detailed by the pharmaceutical reps all about the pharmaceuticals, while they're bringing in the free food, for all the docs and the free pens and the free hats and every way to buy a doctor. This is all well documented. And unfortunately, the medical doctors just don't know anything else, and then ultimately, the guidelines that are written by the pharmaceutical companies, the doctors feel they have to adhere to the guidelines, and the guidelines say statin drugs at every opportunity. And that's why cardiovascular disease remains the number one killer worldwide, and we're not even close to making a dent.
Yeah. So I'd really like to hear from a cardiologist perspective why you find that gluten is not healthy for people. Diana and I have our ideas and our training around this and our opinions, which match yours definitely. But I think it would be good for our audience to hear from you, from your perspective. What do you see related to that?
Well, I think ultimately, we're looking at, the common sense. And again, common sense, our ancestors ate certain foods. and gluten was not one of them. We did not have wheat, barley, and rye. And certainly not in the amounts that we're having today. And of course, all the GMOs and glyphosate and all the other pesticides on there. But when it comes to gluten, again, gluten is one of those things that leads to leaky gut or intestinal hyperpermeability. And that is well documented by PhD researchers. It's in the medical literature. It unfortunately hasn't been studied as much as many other things, including statin drugs. But what happens is that the gluten molecule itself, other undigested foods, unhealthy things, again, like the GMOs, like, other foods, maybe soy and stuff like that should not be in our diet. It causes irritation to the gastrointestinal lining, leading to leaky gut. Things get into the body that don't belong. Now, there's other things that lead to leaky gut as well. Of course, the pesticides, phthalates, parabens, VOCs, mold mycotoxins, other environmental toxins. These all lead to that hyperpermeable intestinal wall. So now you get this coming into the body, the wall is leaky, these proteins get into the body, molecules get into the body, the immune system recognizes them as a foreign invader, and now the immune system starts to attack. That immune system activation leads to inflammation, oxidative stress, and ultimately leaky gut leads to leaky heart, for example, because the lining of the blood vessels is called the endothelium. And when you have the leaky gut, you eventually will develop the leaky heart and the leaky endothelium. So now the endothelial cells start to spread apart, and now you get these oxidized LDL particles, you get these macrophages, coming in. Now you start to set up coronary plaque, and eventually that ruptures. And that is the process of gluten. And then again, as you check people's antibodies, of course, over the last 2 years, everybody's an immunology expert. Everybody's an expert on COVID antibodies. Well, if the human body is making a lot of antibodies to gluten, is actually an umbrella term, and there's a lot of different protein parts of the gluten that actually can be attacked. And these are broken down into gliadins and glutenins. And as we test all those things, we find a lot of immunoreactivity. And essentially, so many people get better by avoiding gluten. It's funny because I get, some patients who come in like, oh, I don't have a problem with gluten, because some people, again, they notice they don't feel well, they gain weight, they got skin issues, and they attach it to gluten. But what about the guy who comes into my office? He's 52 years old. He's, and he's had a heart attack, and he's like, I don't have a problem with gluten. And I said, what if the gluten led to your heart attack? And then now it's an epiphany moment for that person. And, again, there's just no benefit to eating it. So why eat it?
Yeah. Well, it's hard to believe that we're up on time. One thing that I would just love to touch on real quickly before we let you go, you've mentioned one of the foundations of your practice is think well. So can you give us a few tips on how to think well, what that means?
Yeah, sure. I mean, again, like think well is the whole concept. Again, that this is chapter 5 of my book, where in chapter 5 is called One Nation Under Prozac. And I want people to understand that Prozac is not the answer, but when we see that anger, anxiety, stress, depression, social isolation, these all markedly increase your risk of cardiovascular disease, heart attacks, and strokes, that makes it really imperative for us to address those things. And I'm not the best person, certainly, when it comes to helping people find their happy, but I want people to reach out to other people who can help. And maybe that's a social worker, a guidance counselor, a psychologist, not a psychiatrist. They're absolutely worthless. But, someone else who's like skilled in helping people find their happy. But listen, I was unhappy in my job. I quit. If you're unhappy in your marriage, I'm not saying these things are easy, but again, you have to extricate yourself from toxic relationships. And you have to, again, find your happy. Yoga, meditation, Tai Chi, chiropractic care, of course, is essential. I do want to touch on, again, the importance of dental health and wellness, finding a holistic dentist to take care of your teeth, because the high correlation between dental disease and heart disease. But, again, finding your happiness is just so critical. And, again, I want people really to achieve that.
Yeah, I think, the theme that I hear throughout this whole thing is continue to peel the layers of toxicity off of yourself and out of your life. And the more toxic burden we can get off of us, the more our genes can do the job that they're meant to do and keep us healthy.
Totally agree. Totally agree. I mean, our body, one of our things at Natural Heart Doctor, our tagline, if you will, is the 100-year heart. Everybody deserves the 100-year heart, and that, this information helps people achieve that. So I appreciate, you guys having me on.
Yeah. Tell us where people can find you. Tell us what kind of resources you have out there.
Well, listen, probably one easy way for people is my book. And at this point, again, we give away my book for free. All you do is pay shipping. It's over at freeheartbook.com. Again, that's freeheartbook.com. And, listen, I applaud what you two, ladies are doing, and all the, nutritionists out there. I've got master's nutrition, people who work for me. But ultimately what we're trying to do is we're trying to help people. And I'm a practicing cardiologist. I've got a great team around me. If anyone listening, again, needs help, we're here to help. I'm not just someone who appears on podcasts. I actually see and talk to people on a daily basis. We see people in person in Arizona. I do phone consultations. I'm crazy busy, don't get me wrong, because again, not many cardiologists speak the way that I do. And again, ultimately talk the talk and walk the walk. So those are the best places. And again, I sincerely appreciate you guys having me on to share this message, because, again, so many people don't get the message. They're suffering out there. And the more we can share this information, that's the strategy to make this world a healthier place.
Yeah, absolutely. And it is so much great information. I'm so glad we had the opportunity to get this out. And I think that what you've said is going to stimulate a lot more questions. So I'm hoping they'll go to your book to find out more. And I hope our listeners will share this podcast with their friends and loved ones, because I don't know of anybody in my world that doesn't know somebody that's touched by heart disease in one way or another. So, just learning these concepts is the first step to being able to take action. So hopefully this will get shared and, spark that desire to know more, understand more, and take responsibility, right? So that we can do the things we need to do to have that 100-year heart.
Yes. Obviously, right now, the time to speak out, speak the truth is now more than ever. And because, again, the powers on the other side that seem to be against us are forever regrouping, forever formulating. And again, if we trust nature, that's how we're going to get the job done.
Yeah. Well, thanks so much for this conversation, Dr. Wolfson. It was incredible. And thanks to everyone for tuning in today. We can't wait to see you next time. Until then, be well.
Thank you. If you'd like to access other episodes or subscribe so you don't miss a beat, you can find us at nanp.org/NANP-podcast.
Membership in the NANP provides you with a competitive advantage. Whether you're a current practitioner or a student, we want you to become an active, informed leader of the holistic nutrition community and join today at nanp.org. NANP is very proud to provide the highest level of professional recognition and validation in the holistic nutrition industry through the board certification in holistic nutrition credential. To earn this valuable designation, candidates must demonstrate an exceptional level of knowledge and understanding of holistic nutrition by passing a board exam and documenting client contact hours. Are you ready to boost your credibility with board certification? Visit nanp.org today to apply.
Keep in mind that the information on the NANP podcast is for educational purposes only and should not be considered medical or legal advice. The NANP is not liable or responsible for any harm, damage, or illness arising from the use of the information contained herein. By listening to the information on this podcast, you agree to defend, indemnify, and hold harmless the NANP and all agents. Copyright NANP, all rights reserved.